Hello everybody, this is Ichrak ElBehi, a PhD student. I am going to present my article named Epileptic MEG Network Connectivity obtained by MNE, sLORETA, cMEM and dspm. I have worked with Mrs. Abir Hadriche, Mr. Ridha Jarray and Mrs. Nawel Jmail. First of all, I will present the plane of the article, which is considered of the introduction, then methods, after that materials, moreover results, and finally conclusion. The brain designates the most important part of the central nervous system. It is formed by two hemispheres, one right and one left. Each of them is responsible of the reverse region. The lobes represent the four regions of the two hemispheres: the frontal lobe, the parietal lobe, the temporal lobe, and finally the occipital lobe. There are several neurological diseases that overlap the human brain. Among these pathologies we find brain tumors, Parkinson's, Alzheimer, and epilepsy. We will be interested in epilepsy. Epilepsy is considered to be the second most common neurological disease after stroke. The famous markers of this pathology are repetitive cries, and their origins are trauma, cortical deformity. In order to avoid and stop these cries, treatment can be effective in 70% of cases, and in other situations, they cannot calm him down, and we often talk about drug-resistant epilepsy. The area of the brain responsible for epileptic seizure is called the epileptogenic area, and the location of this area is based on several methods, such as the analysis of its MRI and electrophysiological signal like EEG, MEG, intracerebral EEG. The main techniques for acquiring brain activity, either non-invasive techniques such as EEG and MEG, or invasive techniques such as intracerebral EEG. In my work, I use the non-invasive technique MEG. MEG is used to determine cortical regions of the brain and to search for epileptogenic region. In this work, we proceed in defining network connectivity of spike epileptic MEG events, which become extended spike. We will emphasize four methods of resolving the inverse problem: MNE, dspm, cMEM, and sLORETA, and we analyzed their impact on the average of coupling among cortical regions responsible for excessive discharge. Path to methods. These inverse techniques, MNE, dspm, cMEM, and sLORETA, are regarded as distributed methods that use same basic assumption to generate active zone with different hypotheses, where MNE normalizes the current density map, while dspm normalizes the using noise covariance. cMEM is featured by its capacity to recover the spatial extent of underlying source. sLORETA replaces the covariance of noise by the covariance of data. Other materials, all our exploited data and preposition steps are developing on MATLAB MathWorks, NATIC MA, and EEG Lab Toolbox. As a result of the localization of MEG spiky events, this picture shows active region of our chosen spiky epileptic MEG data using MNE, sLORETA, cMEM, and dspm. MNE, sLORETA techniques yielded multiple active regions in coma. Additionally, dspm and cMEM yielded significantly fewer active regions on hemispheres. Here we have used our four distributed inverse problem technique to evaluate the rate of coupling between the active region of subject using spatial extent, scoots and vertices. For each region of interest, we have reconstructed the time series using the singular value decomposition following the projection on the original dipole. The following figures explain for the transit of the patient the time course at the level of the source. Then for each region active during this discharge, we calculate a time course estimate. To assess the association between this active zone, we calculate the cross correlation between these time courses for each pair of signals. dspm, MNE and cMEM provide this highest amount of connectivity. All areas are connected, but they provide a low rate of correlation, while sLORETA provides the highest level of connection between all active sources. Finally, conclusion. dspm, MNE, and cMEM provide the highest amount of connectivity. All areas are connected, but they provide a low rate of correlation, while sLORETA provides the highest level of connection between all active sources. This feeding demonstrates the consequence of this inverse problem approach basis assumption with a tail direct cortical transmission. This result necessitates the employment of several localization approach when analyzing interaxial MEG spike location and epileptic zones. Thank you for your attention.